The Institute of Medicine was asked by the federal government to answer a question. And the question is, under the Affordable Care Act, that's healthcare reform that was passed last year in 2010, which already included the requirement that health insurance plans pay for, without copay, without that additional out-of-pocket cost, a series of prevention services. But what about women? What about women who live longer and have more disability and more chronic disease and have different needs, particularly because of their reproductive health? Do women have additional prevention services that will benefit them and potentially their children? And so we studied over the past 10 months what might be gaps in those services. And we discovered, based on the evidence, 8 different gaps that we are recommending that the Department of Health and Human Services fill so that women get the prevention services that they need. Those gaps include screening for gestational diabetes, screening and counseling for HIV and sexually transmitted diseases, further support so women can breastfeed, screening and counseling around interpersonal violence and domestic violence. And it also included the prevention of unintended pregnancy. That means the full array of FDA-approved contraception and birth control methods, from condoms and pills and IUDs to the morning after pill, in addition to sterilization, should be part of standard preventive services that are covered under health insurance. We also want to make sure women get the visits that they need, so the visit itself should be without copay. This shifts us to making sure that prevention is within financial reach of every woman through her health insurance plan.